So welcome everyone to tonight's webinar, Food Sensitivities, Why Removing More Food Groups Probably Isn't the Answer. Tonight we have Dr. Amy Morrison joining us from Nirvana Naturopathic Clinic here in Calgary. She's a naturopathic doctor who kind of focuses on chronic inflammatory response syndrome with her patients. So thank you so much for joining us.
Yeah, thanks for having me.
Yeah. Awesome. So I was excited when I saw this topic because I've gone through this all as well. So maybe we can just kind of start with the difference between a food sensitivity and a food allergy.
Yeah, absolutely. So yeah, food allergy is super common when you think of like peanuts. Let's say you eat it, it's something that's going to be an immediate reaction. We can tell food allergies with a certain type of immunoglobulin in your blood. So IgE is what that would be called. And so that is like the anaphylaxis, swollen tongue, can't breathe, swollen lips, like very severe, pretty immediate onset. And then we have food sensitivities, which is going to be more of a delayed onset. So that's an IgG immunoglobulin that we're going to test for, or you can test for in blood work, is more correlated with that. Those are a bit more tricky for us to figure out what they are, because that can be 48 to 72 hours after you ingest a food or eat something that those symptoms are triggered. So it's 3 days ago, you could have had something, and then today you're not feeling great. So they're a bit more tricky for us to define what they are. And then the last one I always talk to people about too is just food intolerances. So that's more of like a lactose intolerance that people have, say they have a sensitivity to dairy, but that is more of a enzyme. It's not a immune dysregulation that's happening there, immune system issue. It's your pancreas doesn't release the lactase that you need to diagnose with to break down the lactose in dairy. So there's 3 kind of different areas of food allergy, food intolerance, and then the food sensitivity, which is the more common reasons I tend to see people of, I eat this food, don't feel great for a few days, and it's a bit more hard to figure out what it is because you're eating multiple things in over a 3-day time period. Well, hopefully.
Yes.
Yeah.
Yeah, they seem like food sensitivities in general seem to be just so more prevalent, like among everyone, kids, adults. Yeah, do you think is there like some correlation between that or anything you've noticed kind of over the past several years, just of why that seems to be increasing so much?
Yeah, I think there is. I think it's easy, I would say, for us to like attach our symptoms, of course, to food that's happening, but I do think it's more of something that's in our system, whether that be immune dysregulation or actually hormones and from our brain that are causing more issues in our gut, a bacterial imbalance, whether that be in your gut, in your sinus cavity, in your mouth, that are leading to more of a disruption in your gut and the way that the immune system reacts to the proteins in those foods. They have to get through our gut into our bloodstream, and then that's when we develop those food sensitivities. So it's basically looking at the gut integrity there and figuring out what is the cause of that is then leading to food sensitivities. And I think all of those upstream issues are actually what is triggering that, and those are becoming a lot worse, or we're learning more for people. There's just a lot more on our system these days that are piling on, and then we develop the food sensitivities or reactions to foods that we think are happening.
Yeah, probably maybe just environmental kind of pesticides, herbicides, that angle as well, just more prevalent in today's society, just in general. And
a lot more convenience obviously is part of this, but packaged foods with emulsifiers and processed artificial sweeteners, processed foods that are also causing that kind of intestinal hyperpermeability that is increasing the way our immune system will react to the foods. Us not being able to break down our foods as properly as we used to be, eating on the go. We don't chew our food as well. We don't have enough stomach acid to help breaking down those proteins that will then cause that. So I think it is like just multiple factors that then lead to that increase in what we're seeing with people just being so sensitive to multiple foods instead of just 1 or 2.
Yeah. And for someone trying to figure out, it could be they have a couple things going on, like, viral load or an an infection. I guess, what are some tests, if someone did have a couple food sensitivities or several, what are some kind of the first line of defense tests that you would recommend?
Yeah. So maybe I'll split this up. So I'd say like the classic food sensitivity test is like a blood draw. Basically, we get back the foods that your immune system is having that IgG reaction to, and then we can see, I guess, the gold standard for food sensitivity and actually diagnosing that is that elimination, and this is where that elimination diet comes from. So even if you do have the elevated IgG immunoglobulin in your bloodstream to, let's say, 10 foods, that doesn't mean you're sensitive to all 10 of them. So when people do that testing and then just eliminate them for the rest of their lives, I'm like, no, we actually need to reintroduce those to make sure that you are sensitive to them. Because if you're not, then I want you to be eating those foods. And especially if you want to be eating those foods, a lot of the time it is everything that you commonly eat. So we want to get those foods back into your diet. So kind of that gold standard test is that elimination of them for a few weeks and then introducing them to see if we can mount that response that your immune system is reacting to that. The caveat, I guess, with those tests is our immune system is supposed to increase that IgG when you are exposed to something a lot over time. So even though that's high in your test, it might not actually be indicative of what you're sensitive to. And then my go-to, I guess, when people have a ton of food sensitivities, we're not just trying to nail down one or two things in your diet, would be more looking at digestive function in the microbiome in your gut. So if there is a imbalance of bacteria or an overgrowth bacteria or yeast, those are actually going to be the molecules or species, I should say, that are feeding on the fiber that you're eating and then can elicit a lot of, let's say, bloating, gas, abdominal pain, changes in bowel habits, so diarrhea, constipation. So dealing with that microbiome in there and that imbalance of bacteria in order to reset that so that you can just eat fiber-rich foods and you don't have any of those symptoms. That's kind of like the local testing that I look at if digestive symptoms are the only symptoms that somebody's experiencing, then that would be my go-to, is more of that microbiome test. In that test too, it'll give us like an intestinal health panel. How well are you breaking down your food? Is there any like mucus or fat or carbohydrates, proteins in your food that we actually just need to support that full digestive system? Again, back to like chewing your food. Do you have enough stomach acid? Do you have enough pancreatic enzymes that you're releasing in order to actually make sure those foods are broken down so that the proteins aren't too large and getting into your bloodstream? We're actually efficiently breaking it down into the amino acids that they should be. If it's more of a higher upstream and people have more symptoms, so sleep issues or low energy or headaches, then I'm more actually looking into further digestive testing with the immune system. So if there is too much inflammation that's happening in your body, and whether that be an imbalance with your immune system or something else that's causing that, so infection or biotoxin exposure, then we're going to be looking more at hormones that you can measure from that immune side of things. So one of them being MSH or alpha MSH, that actually directly correlates with how permeable your gut is. So if that MSH level is low, then you are going to have that hyperpermeability, or that leaky gut would be the other common term for that. And if the MSH is low, no matter what we do with from a food perspective or what we do from a microbiome perspective, treating that, we need to get those hormones back on track so that your gut can actually heal. There's tons of research behind glutamine, which I would say is the most common one that we can use to help heal your gut. But again, if that MSH isn't high enough, then we're just gonna be fighting an uphill battle with that. So then we're looking more into like that innate or brain or hormone side of things to see if there's upstream causes that can also cause all of those other symptoms. So it's kind of like two piles. If it's just digestion, then we can run those kind of more isolated tests. If there are some lingering symptoms from other areas too, then we got to look further upstream to make sure what is actually causing this.
Yeah.
Yeah.
And that's the GI map. Is that the GI map test?
So we use the GI 360.
Okay, yeah.
Yeah. The GI map is, I would say, similar. It's not as comprehensive when it comes to the normal microbiome and all of like the good bacteria that's in there. So it's a similar idea. It's a PCR, same as GI map, but then there's also a culture component to it, just to see if there's any species that we can catch that are growing that should be.
Right.
Yeah.
Yeah, that seems like, because a lot of people, take supplements like L-glutamine, like you said, aloe vera or slippery elm. But yeah, they're kind of just, it's a guess, right? Until you actually get a specific test and you can really target kind of those areas of imbalances.
Yeah. Yeah.
Yeah.
And I mean, a lot of people that we see have tried these things. So it's like when they work, I know they work, I've seen them work. And so it's really great when they do, but it's kind of when they stop working or they don't work anymore, then we're diving into something else.
Hmm.
Yeah.
Yeah. So, I also wanted to talk a little bit about histamine and just, I don't know if those tests check for that as well. Again, I just feel like more and more people have histamine problems. So, if they're going the food route, they're told to take, or to eat a lot of fermented foods, but for those people, that can make things worse. So, yeah, does that test include that? And how is that kind of?
Those tests don't. We can test for like whole blood histamine to see what people's histamine levels are. If we are looking more upstream when we think it's something when they kind of have multiple symptoms of histamine release or a little bit more comprehensive than just GI, then
Yeah.
there's some like epigenetic testing that we look at to see if those histamine markers are turned on or turned off. With the mast cell activation syndrome, some of the good first line trials are actually more using medication from a standpoint of like, okay, if we actually lower your histamine, do things get better? If you do, then we're probably on the right track. If they don't, then we got to move on to something else. Like with that
Mhm.
condition, it's pretty clear cut. If they work, then that's good and we're on the right track there.
Right.
Histamine, they're actually having a bit more research I'm going to say with the IBS, and a lot more of maybe what I've been hearing recently is that visceral hypersensitivity and those nerves in your gut are
Mm.
more activated or just a little bit more sensitive to when you're eating certain things or you're feeling that gas a little bit more and that pain is a bit more severe than what we would normally think should happen when we do that. And they are linking that more mast cells are activated in the gut with that visceral hypersensitivity. So I'm going to say the research is kind of coming with that for the IBS type of things with the mast cell histamine release there, which is very
Hmm.
interesting. Yeah.
Yeah, I notice a lot more maybe apps and just other practitioners talking about IBS and yeah, not maybe a diet approach, but more of a getting out of that cycle because now your brain you're so hypersensitive to everything you eat and you're fearful and just yeah, that cycle you get caught up in and kind of breaking that. Yeah, I just find that really interesting because for so long it was like food,
Yeah.
elimination, and yeah, now it's more of like a psychological component, which is pretty interesting.
Yeah. And that's what like definitely with I'm going to say like you go to your family doctor, they rule out everything. They've done all the scopes and further
Yeah.
testing that they can do, and you are diagnosed with IBS, and they give you that low FODMAP diet, which we are noticing that is maybe not the best. It definitely helps symptomatically. I'm not denying that. That is great. But at the end of the
Yeah.
day, we want people eating the most diverse diet that they possibly can. And I'm going to say with the community natural foods, probably preaching to the choir, everybody that's on here, but like that whole foods diet, rich in a
Yeah.
different bunch of different types of vegetables and fruits. And we want that fiber in your diet. But when you look at that low FODMAP standard treatment for IBS, it is like it minimizes a lot of those foods that we want in there to help feed that microbiome and make that the bacteria in your gut more diverse than what it might be currently. And the issue is when you can't eat those foods or they make you feel uncomfortable
Hmm.
and trigger symptoms for you, then it can be really frustrating because you're like, I want to eat these foods. I know I should be eating these foods, but I can't because I don't feel good. And so then that's when we're looking at, okay, what is actually causing this? Is that the histamine release that's making my gut more sensitive, or that's one of the mechanisms, or is it a microbiome? So there are like a few things, but yeah, it is interesting when that was. I think that's potentially starting to get phased out, and a lot more people are talking about that microbiome imbalance that's happening in there. But I still see people probably every week that are that's what their resolution is, and I'm like, okay, we need to get you to a place where you can eat more. There's a lot of joy and we bond with people over eating, so
Mm.
there is more to it than just eliminating things. When you eliminate foods, you're also taking away a lot of freedom and flexibility for people, and so it is really important that people can go out and feel safe, that they can eat and not be super worried about other things that touch their food or cross contamination of certain things.
Yeah.
Yeah.
Yeah, you mentioned, checking for viruses or any active viruses, but what if someone, let's say, several years ago got food poisoning and ever since then they've just had issues? Is that something that you can kind of pick up on as a test, or is it something, yeah, that physiologically happens in your body from that point on that causes
Yeah.
maybe food sensitivities?
Yeah, that's a really good question, actually. I'd say food poisoning is one of the most common triggers that can, I'm going to say, trigger IBS or these food sensitivities, or just like that sensitivity to eating a bunch of different things. And one of
Yeah.
the main mechanisms behind that is actually when you're exposed to a lot of the toxins that come with the food poisoning, they will damage part of our body called the migrating motor complex. That's going to be the nervous system that innervates our gut, our whole system, basically our mouth to our bum, that makes sure everything moves north to south. And so
Mm-hmm.
that you can think of that as like if you haven't eaten for a bit and you get that like grumble in your stomach, that is that migrating motor complex working and moving things through you. And if that's damaged, then we're going to get a lot of that over or normal bacteria that's in your large intestine move back up into the small intestine, because it's not, our body's not working properly to keep it out of there. And then when there is
Mm-hmm.
that overgrowth in the small intestine, the toxins that are produced by that imbalance of bacteria, those LPS toxins, will create that leaky gut picture. And then you develop the food sensitivities, because those tight junctions in the gut that should be holding the cells really close together so those proteins can't get in are now open, and your food that's not fully digested, that's in the small intestine where it's supposed to be absorbed, can just get right into your bloodstream. So food poisoning is, I'd say, like one of the most common causes, if like by a long shot, 70 to
Mm-hmm.
80% of like the SIBO, if people have heard of that, the small intestinal bacterial overgrowth, or SIFO, small intestinal fungal overgrowth, all of that dysbiosis or imbalance of bacteria, that would be the most common cause of that. So huge. Yeah.
Yeah.
There is that other, the chronic inflammatory response syndrome that you mentioned at the beginning. Certain types of food poisoning can trigger that for people as well. So
Mm-hmm.
it's not necessarily that you might just start with digestive issues, and then over the years you get some sleep issues or chronic pain or low energy, and it's like, okay, we might actually be going back to that biotoxin exposure from that food poisoning that has triggered this inflammatory cascade in your body.
Mm-hmm.
Yeah.
Yeah, that's interesting. Um, you were talking a little bit about hormones as well. So I guess how do they play a role? Maybe we can talk a little bit about thyroid and cortisol, just how they kind of play a role with food sensitivities.
Yeah. So there's kind of like a cascade of hormones. So leptin being, I'm going to say kind of the top of this, if we're making a really simplistic term of that.
Mm-hmm.
Leptin is going to be, if we research it, it's going to be one of the regulators of our hunger. So the more leptin you have, the more hungry. If leptin's working appropriately, that's going to be what drives us to eat food.
Mm-hmm.
Leptin can be one of those ones that gets thrown off or damage that leptin receptor with that biotoxin exposure. So whether it be food poisoning, a chronic infection, Lyme disease, mold exposure, that's going to be one of the first hormones that gets dysregulated. Basically, what happens is that toxin will ruin that receptor so that that hormone can't bind to it.
Mm-hmm.
Leptin, though, then in turn is going to impact thyroid function. So again, it's like, are we starting with the thyroid, or is it actually an upstream hormone that we need to look at? But if thyroid's not working, I'm going to say hypothyroid, so underactive
Mm-hmm.
thyroid, then again, you're getting that slower gut motility happening, similar to like that migrating motor complex. You might get some constipation, and then you're going to get a backup of that, or an imbalance of bacteria again in your gut. Everything's not moving appropriately, and then that can lead more to that leaky gut picture as well. Cortisol, same thing, kind of related more to our nervous system. If you're super high stress, all of our blood is going to be flown to our extremities and not our gut. That leaves our gut definitely vulnerable to larger proteins not being able to be broken down. And then you're more likely to react to foods, because we don't have all of the energy we need in order to break down our food in order to absorb those nutrients. So higher stress, cortisol is not a bad thing. When it's
Mm-hmm.
high for too long, then that's when you're going to get a lot of digestive distress with that. A lot of times you can see when people have like, I'm super stressed, therefore my stomach is worse. And you're like, okay, yes, cortisol is definitely going to be related to this. And we're just not getting that blood flow, where your nervous system's not working appropriately it's not focused on our nervous system. It's focused on running from that line, and that classic example of that fight or flight. So doesn't care about digesting and absorbing your food.
Mm-hmm.
Um, so yeah, leptin will be correlated with that thyroid. It will be correlated with cortisol. And then that other one that I was mentioning, that MSH or alpha MSH, leptin directly is correlated with, once that leptin hits that receptor will then produce MSH. So if that leptin's not working, that MSH won't work as well. And so there's, the kind of a few hormone pathways there that impact that from a,
Mm-hmm.
upstream perspective. Yeah.
Right. And like with chronic stress, over time, can that affect like the gut permeability as well? Just if you have that increase of cortisol?
Yeah, yeah, totally. And it might be something too that, and a lot of times actually I find this maybe is more of the case. A lot of us know when we are feeling a high stress, like where people say that they handle stress well, but a lot of this can actually be um, kind of the way that our subconscious brain and our nervous system fires before our conscious and logic mind. So you might actually, your body might be in a chronic state of stress, even though logically you feel like you're doing okay. You're like, no, this,
Mhm.
I've been through worse periods of time in my life. My stress has been higher, but right now I feel pretty good. That doesn't
Yeah.
necessarily mean that your adrenaline or your nervous system or your cortisol levels are appropriate for digestion and allowing your gut to heal. You can still be in that fight or flight state and not that rest and digest where we need to be in order to digest foods, heal our leaky gut, make sure our gut microbiome is good. So even though you might be under stress for long periods of time, but it might be something too that it's more of just like the way your nervous system is always on alert and you're always screening for that external environment to see what that next threat is to your body. That could just be
Mhm.
something that you've just conditioned your body and your nervous system to do, and you're not allowing yourself to heal. You're never actually dropping out of that into that rest and digest in order to get to that state. So huge part of
Yeah.
it. Yeah,
Yeah, that's tricky. That's a very tricky cycle
yeah.
to break. I guess if someone was wondering, like you said, they think they're okay, they've been worse off. Is there other symptoms? Like maybe, yeah, like they're still having a lot of digestive issues or other symptoms that would maybe kind of point them in that direction to maybe get some testing done to see if they're still in that flight or fight.
Yeah, so I'm not sure if I'm potentially other people I work with have been on here, but if we do that neurofeedback or the neuroanalysis at Nirvana, and we can actually see how well your body's regulating and how well you can drop in and out of that fight or flight, rest and digest, or even if you're dropping into that like faint or freeze state, just kind of like that
Mhm.
third dorsal vagal side of the nervous system there. That's kind of like where you're going into overwhelm or feeling helpless and hopeless. And so ideally we go back and forth between that fight or flight and rest and digest. But then you can drop into that other one. So when people are coming in and I'm like, they have digestive symptoms, but then potentially some mental health, more depression, definitely sleep issues is a huge one, but kind of wired and tired. Your body's not actually dropping into that state. You're kind of more in that burnout zone, even if you're like, I feel pretty good, but I just can't get my mind to turn off.
Mhm.
A lot of the times with immune system as well. So getting sick really frequently and or taking a longer time to heal from things, that's something too we're looking at is like, okay, maybe your nervous system is, you're kind of in that state where you just can't allow your body to heal, or it's taking your body longer than what we expect to see to heal. Then you're like, okay, we need to take a dive into this. Energy is a huge one with that too. I find like if you're in that kind of fight or flight state as well, it can take a lot of mental energy for people to be able to focus on a task or get something done, concentrate. You're like, and then you're like, okay, we got to get your body into a state where you can actually rest again. And even though this is like your normal, you could have been living like this for 10, 15, 30 years. It doesn't mean
Mhm.
it doesn't need to be your normal. We just need to look at how to get your body to adapt to both of those states and feel safe in that rest and digest so that your body can get back to healing and digesting food.
Yes.
Yeah. Yeah.
Absolutely. Yeah, it's always tricky in this environment.
Yeah.
In
Totally.
this
Yeah.
world we live in right now. Yeah, I think a lot of people that I talk to are just, I just want to go live in the woods or the mountains and
Yeah. Yeah. I
not
feel
have
like
to
we're
worry
all
about
craving,
anything.
yeah, craving this state of that, just like, yeah, when you go on vacation or yeah, you go into a cabin
Mm,
in the woods and you just get there and your body, you can just feel it instantly
hmm.
release all of that. And then as soon as you come back into wherever it is, work, full-time moms and working, whatever that stress or
Yeah.
society has like not allowed us to relax.
Yeah.
Yeah. Yeah.
I know, we got to
Yeah.
figure something out.
Yeah.
Um, I guess just back to diet a little bit.
Yeah.
So, um, in the beginning, you had mentioned doing an elimination diet. So is that kind of the start? kind of, I guess, the major food groups that most people are sensitive to? Is it eliminating those for most people and then slowly adding them in, just to seeing like what responses their bodies are having?
Yeah, so that would be like if it's going to be something, I'm going to say more basic. This isn't basic, but like the
Yeah.
big food groups, so like, yeah, gluten, dairy, corn, soy, and
Mm.
we're looking at those, then those can be, again, relatively easy. It's not,
Yeah.
but like easy to eliminate those. And then when you do reintroduce those foods, challenging them back in one at a time so that we get a really good idea and sense to what foods you're reacting to. So I'm making this up, but if we're taking away gluten and dairy and then you challenge it with a pizza, then you're going to be reintroducing both of those. So we don't actually know which it is. So if you do it one at a
Right.
time, then we can monitor those symptoms for 3-ish days. Um, Definitely after you have consumed that, to make sure that if there are any symptoms, then it might be that you are sensitive to that food, because there are food sensitivities out there that are definitely very common. But I'm going to say gluten, non-celiac gluten sensitivity. It's definitely a
Mhm.
thing. It's very common. And so those are something that, okay, definitely we want to eliminate. That might just be something that people tend to avoid, and that's, or when you eat it, you just know that you're not going to feel really good for a bit, and that's fine too. But
Yeah.
we know that it's not necessarily doing any damage where celiac would be.
Right.
Where it gets, and so yes, you'd eliminate those and then challenge them back in one at a time to see that. I do find it a big issue with the elimination diets is when it's everything, like doesn't matter what people eat.
Yeah.
Uh,
Yeah.
they wake up, they feel pretty good, they have a meal, and then their symptoms start, or they drink water and their symptoms start. And you're like, well, you can't eliminate everything. And I have had people do food sensitivity testing or want to eliminate everything, and they actually then tend to feel worse. You're not eating enough, usually, is what happens there, or you're eating all these foods that you don't actually like, or
Yeah.
it's not providing the proper nutrition that we need in order to have energy, or in order to feel good throughout the day. So that's when it gets really tricky with an elimination diet, because there's too many foods to eliminate. You can't eliminate everything that you're eating. And so people can do it in stages. So that's options that I've given people before. So that's pick some food groups that maybe it's one big food group and a few smaller food groups that we eliminate at once, do kind of that elimination diet, and then move to the next. So at least you're getting more food in your diet um, over time. So we're not eliminating everything at once. That is an option. I mean, it does take potentially longer, but if you feel better, then I think it's worth it. Yeah.
Hmm.
Um, Usually though, when we're getting back to that, like, doesn't matter what I eat, I react, then it's probably not a food sensitivity. Like, I'm not saying your immune system might still be reacting to those foods, but it's got to be something upstream. It's got to be like that intestinal hyperpermeability. It's got to be your microbiome. It might be hormones. It might be stress. Then we got to work on that. And I actually encourage people just to continue the way they eat, unless something is very problematic. Like if you know every time you eat X, you're down and out for 3 days, then for sure don't do that. But for the most
Yeah.
part, I still want people to include the most amount of food that they can in their diet, so that they're not feeling good digestively, but at least we know whatever treatments we are doing, it's actually working appropriately on the system that it is, versus just eliminating foods and they feel better for a short period of time. And then we actually don't know if the treatment that we're doing for whatever is the cause for them is working. So
Yeah.
yeah, I think there's some um, even just like a lot of with the research, I guess now with diet and eliminating like low FODMAP foods or those fiber rich foods, you can change the microbiome with just in a few days. So we want to make sure it's the most diverse for ever. So we
Yeah.
don't want to
Yeah.
necessarily kill off any certain species by eliminating foods unless we really have to.
Yeah. Yeah, I think that's where like the carnivore diet is really popular because people feel if they have lots of sensitivities, they feel great.
Yes.
But yeah, then you're just eating a small amount of food for a long time. Yeah, then you're losing that diversity, and I'm assuming that's harder to get back
Yes.
over
Yeah.
time, right? The longer you do it, yeah,
Yeah. Yeah.
yeah.
And especially with, yeah, the carnivore diet, I I don't doubt people feel better when they're really sensitive to a lot of this stuff, because you're just eliminating all that fiber. But then if you do want to get back to a place that you can eat these foods, or to a place where you eat these foods and you feel good, then yeah, depending on how long are on it, I would wonder, it'd be interesting to see how long it would take for people to actually get back to a microbiome that's diverse when you're
Hmm.
incorporating those foods. I assume it would have to be like a very slow reintroduction.
Yeah.
Yeah. Yeah.
Um, what about fasting? So just because it is quite popular, it still is.
Yeah.
You know, if you're doing keto or whatever diet you have, a lot of people are fasting. Does that benefit just giving your body that time to reset and digest? Because I think too, like you'd mentioned earlier, convenience, right? A lot of us are snacking all the time and just, you know, we have food readily available all the time. And over time, just eating so frequently might not be the best. So yeah, what are your thoughts on that?
Yeah. Yeah. Fasting I always find is an interesting one. So I feel like if you are completely healthy, then fasting can provide a lot of benefits for us.
Mhm.
That's not the population I work with, so it's not
Yeah.
necessarily a huge conversation. I'm more talking people of reasons why they shouldn't fast, but there is a ton of research
Okay.
behind it and um, of why it's good for us. There are with that like biotoxin, actually our cells can't break down fatty acids for energy, so we do need that constant stream of glucose in our bodies until we fix the way that our mitochondria are producing energy, and then we can get people onto a fasting kind of diet like that. So if you're healthy, lots of benefits. If you're not, it might not necessarily be the best. This is purely anecdotal, but I do find men tend to do a little bit more
Hmm.
like better on ketogenic diets and potentially fasting. The way females and our hormones, estrogen and progesterone work, we have that constant signal from our body to our brain and then our ovaries, if we're what that energy intake is like. So if we are doing long periods of fast, potentially it might not be the best if I'm going to say you're trying to get pregnant. If you're not,
Hmm.
then it depends. There's so many other factors, but
Hmm.
so potentially a little bit better and more research in men, which is classic usually with the research.
Hmm.
Um, but with intermittent fasting, a lot of people I do get and I see them that they're on like say 12 to 8 feeding window. So they'll fast until noon and then they eat until 8 or whatever that is.
Hmm.
And a lot of times my conversation more around that, if they are feeling really good on that diet, it's not necessarily about getting them off of that, but actually just changing that feeding schedule to link up with when our insulin is secreted, when we actually need that energy in our day. So it'd be more important to have breakfast and lunch and a say early dinner than pushing those schedules later. Um, so I think they are beneficial. I think it just depends. I wouldn't say that they're beneficial for everybody. I definitely don't recommend them to everybody, but there is definitely a point to like giving our digestive system a break. We just got to make sure that our body can actually use our fat stores in order to produce energy so that we can still feel good. You still want to feel good on them. We want to make sure we're still having bowel movements if you're doing longer periods of fast so that you're not reabsorbing the toxins in there. So yes, are good with some caveats on the side there, I would say. Yeah.
Hmm.
Yeah.
Yeah, I was actually gonna ask you about like kind of the circadian rhythm, even just like as something anyone can really do. Maybe, yeah, like you said, just eating in the morning, like kind of with the sunrise, the insulin, cortisol
Yeah.
kind of yeah, eating and then when it's dark out, and I know it's tricky, especially us going into winter here. But yeah, just even not eating when it's dark, so you can produce melatonin and all those things. So is that something you recommend to your patients as well?
Yeah. There's like a kind of like the light with the food. So
Yeah.
getting outside first thing in the morning, again, Calgary, it's a little bit harder and depending in the winter, or
Yeah.
when that sun is up kind of within an hour there, that's going to really be that light exposure to trigger our circadian rhythm. And our body actually has a few different types of circadian rhythms. So then we have our GI tract that's in our enteric nervous, or yeah, in our enteric nervous system that has its circadian rhythm as well. And so we want to make sure that our sleep wake cycle and our digestive cycle is on that same cycle so that we get the most benefit out of it. And so if you're waking up at 6, I'm making this up, but you wake up
Yeah.
at 6 and then you don't eat till 2 and then you have low energy. Well, you didn't provide your cells that nutrients that it needs in the morning in order to have that energy throughout the day. But then if you're going to bed at 10, you don't need to be eating super
Yeah.
late at night or later into the evening. So if we can kind of pack that morning with when our body wants to have food, when our insulin is going to be more released in the morning. So that's what's going to drive that energy from our food into our cells. We want that energy to be there so we can utilize it and make energy for everything, for us to have energy and then all of our cells to do what it needs to do. So aligning those more appropriately is like makes a huge difference for people. Yeah.
Hmm. Yeah, I was listening to a podcast actually today, a little bit about that, and just I found it interesting because we're such creatures of habit as well. And I think throughout the year we try and eat the same kind of every day, but yeah, seasonally, maybe in the summer, we can get away with eating later, and in the winter, like we just talked about, eating not as much late at night when it gets dark. So
Yeah,
yeah, we need to like kind of go with the seasons, and it doesn't have to be the same all the time.
totally. Yeah.
Yeah.
Yeah. You can change and flow and all the different types of like eating in the seasons too, what would actually be
Hmm.
available to us, warmer foods in the winter, whether that like yes, temperature, but also you're gonna have more root vegetables versus in spring. I find a lot of us crave smoothies and green salads. So you're gonna fluctuate like that too with not even just times of the day, but yeah, foods that you do consume as well.
Yeah.
Yeah.
Um, with gluten sensitivity, I just wanted to go back to that for a
Yeah.
second. So if you did the GI 360 test and it came up that, because that tells you if you have sensitivity to gluten, correct?
So the GI map does, but the GI
Yes.
360 doesn't.
Oh, it
Yeah.
does. Oh, okay.
Yeah.
Sorry.
Yeah. So yeah, the GI map has well, there's two things on there. So there's the one that's the anti-TTG. So if your body basically is reacting to one of sorry, that's a blood test. A molecule on there, one of the types of gliadin is what it's looking for to see if you're
Oh,
reacting
okay.
to that, kind of like more of an inflammatory marker. Then you can
Right.
also do an add-on test for zonulin in that GI map, which gluten tends to release. Zonulin will open the tight junctions in your gut so that you're more likely to have food sensitivities. The GI map tests that, the GI 60 doesn't. So
Oh, okay.
there's a bit of a difference there with those tests.
Okay.
Yeah.
I guess then just theoretically, just using gluten as an example, um, if you did have some of those sensitivities and they were confirmed, is that something that's kind of there for life and that's not really, you can't really fix? Or is there, like you said, those underlying causes, dysbiosis or leaky gut that can kind of, if you fix those over time, you might be able to eat gluten again?
I would say yes to both. I think some people,
Okay.
it might be like a
Yeah.
lifetime thing that you're just sensitive to that. And um, I think, and then some people it might be, yeah, that there's another cause to that. And then gluten just is one of the ones that you're more reacting to. I always find it interesting, and some people here might have tried this, but in Canada or the States, you eat gluten products and you don't
Mm,
feel really great. And then you go to Europe and you eat gluten-filled products and you are totally fine. So I
yeah.
think too, then there is this level, and usually a lot of the times with food sensitivities, it's actually more of that threshold. So you can get away with eating gluten twice a week and you're totally okay with that. But as soon as you're having it more often than that, then that's when you start to develop symptoms. So I always encourage people to, if they want to eat those foods, okay, let's just find that threshold. And then when you go over that, you might have symptoms, but at least at least 2 or 3 times a week you can get away with eating this. And as long as it's not causing any further harm and it's just those symptoms, and that's always up to the person. Yeah.
Yes.
Yeah. Yeah.
Would that, like with gluten, um, would that cause inflammation over time though? Like if someone kind of was like on that threshold and not sure, yeah, is that something to look out for as well?
Totally can. So definitely with gluten specifically, I'm going to say more than, well, that versus other food sensitivities. With that zonulin marker, some of the research that I've read with that is that it's just going to release zonulin in a large portion of the population. So you're going to have
Mm.
more leaky gut when it comes
Mm.
to eating gluten, even if you're sensitive to it or not sensitive to it. And so then when you do have that hyperpermeability in your gut, your immune system is going to be seeing things that it shouldn't be seeing. More toxins are going to get in, more proteins going to get in, and then yes, you will potentially have more inflammation from that. So that is always a risk with that.
Hmm.
Yeah.
Yeah. What about like, are there any, just simple kind of tips and tricks like, drinking water 15 minutes before a meal and then an hour after, or apple cider vinegar for some people that, yeah, just can, help their digestion, to prevent food sensitivities per se?
Yeah, totally. So when we're looking at, I guess, like that mechanism with food sensitivities, it's going to be about making sure the food and the proteins or that we're eating are being broken down efficiently. And so the first step to that
Mhm.
is going to be making sure that you're chewing your food properly. So ideally, if you're sitting down to a meal, you're not on your phone, you're not watching TV, and you're having a few deep breaths before that. Um, Basically doing the deep breaths, you're calming your nervous system, you're getting into that rest and digest. When you're in that
Mhm.
rest and digest state, that's going to allow your stomach acid to flow, your pancreatic enzymes to flow. That's like when your body's going to be able to break down food optimally. And actually, a step before this is even just making your own food, smelling those spices, working with the food, touching that food. That's actually one of the first steps in order to your digestive system to break all that food down. And then from the water perspective, yes, we don't want to necessarily drink a ton of water with our meals. That water can dilute the stomach acid, which then won't break down your proteins as effectively as you might be able to. So if you are feeling like you are a bit more sensitive to eating, then I would not have water with meals and or just small sips. You're not having a big
Mhm.
liter beforehand or anything like that. And then yes, apple cider vinegar, whether that be trying it straight or in capsules, or you can get some digestive enzymes either with like the betaine HCl or just the betaine HCl
Mhm.
themselves. You can try that to help support your stomach acid levels to help break that down. And actually, when our food goes into our stomach, mixes with that stomach acid, the acidity of that contents when it is released into your small intestine, that's going to be what triggers your pancreatic enzymes to release. So if you don't really have any stomach acid, then you're also going to impact your pancreas from breaking down foods there as well. So then that's when some people also tend to feel better with digestive enzymes. You're just giving your system the enzymes it needs to help break down that food further. And then once we get our food broken down into the smallest forms possible, then ideally you shouldn't be reacting to those proteins in foods because those proteins are now amino acids and easily to be absorbed. And that's what your body knows and wants. So yeah, there's kind of like a few steps, more of like the pre, and then yeah, making sure you're not drinking a lot with that. And then yeah, you can take those kind of aids, apple cider vinegar or the supplements there just to help support digestion to make sure that your food's broken down the way it should be.
Mhm.
Yeah.
Yeah, those are great tips. Okay, we have a lot of questions. So probably won't get to all of them. And I'm just gonna try and go through the ones that are relevant to kind of what we're talking about. But yeah, if some of you weren't on the call at the beginning, this is recorded and will be sent out along with information if you want to work with Dr. Morrison as well. So if we don't get to your question, you can always reach out there. All right. Let's see here. Is it better to do a food sensitivity test or an elimination diet? How accurate are food sensitivity tests?
Oh, which one's better? Yeah. So the gold standard is an elimination diet. The food with the food sensitivity tests, they are strictly a guide. They do not tell you which food sensitivities you have. So it's kind of something or a tool that I always talk to people about that we can use in order to help guide an elimination diet versus eliminating everything at once and then reintroducing one at a time. So food sensitivity testing is like basically what we're testing for that is your blood, your immunoglobulin IgG. Your IgG will rise when your immune system has seen a protein in food multiple times. That doesn't mean that you're having symptoms from it though. So then we use that testing in order to guide an elimination diet, but the standard would be elimination.
Okay, awesome. Just gonna try and shorten this. So with Candida, I guess this person's asking, there is supposed to be some yeast in the gut. It's more of that overgrowth. Is there a specific way to test that to see if that's causing issues for food sensitivities?
Yeah, good question. So yes, Candida is part of our normal microbiome. It's all over our skin. And it's only when it gets out of control that it basically causes those issues for us. And I'd say with a lot of the focus being on microbiome and bacteria, antibiotic use, then it's really easy for that Candida to take over. So I would say actually one of the better tests for Candida testing is an organic acids test. It tests for a molecule called arabinose that is in our urine, and that's only produced by Candida. So then when these companies, I guess, take the reference range that we need to see. There's going to be some that is completely normal for us to have in our urine. Again, that Candida should be there. But when it's over that range, then that's when we're looking at that's an overgrowth and potentially an issue for you. Same thing kind of with Candida. If you're getting thrush, oral thrush, yeast infections, then we're going to be like, okay, this is probably an issue for your body or too much for your immune system to handle. So that's going to be kind of the standard there. If we are doing that microbiome analysis, you can see with a PCR and a culture if there is a Candida overgrowth or an overgrowth of another yeast or fungus that is in there that potentially shouldn't be. So there's a few ways to test for what would be too much. But yeah, it is part of our normal microbiome. I know if people have done food sensitivities on here, there is a marker on a lot of the food sensitivities testing is for that IgG, that immunoglobulin to Candida. And so the idea behind that is if it is super high, then your body is being exposed to a lot of the toxins that Candida is producing. And then potentially you might want to treat it for that, or that's how I've seen practitioners treat that too. If that IgG is off the wall, then you might be looking at Candida too.
Awesome. I've developed intolerances to so many foods all of a sudden: gluten, dairy, corn, nuts, soy. Tried a lot of medications and different things, but nothing has worked. Any idea kind of what's going on? This person is in their mid-20s as well.
Okay. That's when there's a ton of, I assume like all at once, like a ton starting like that, I would actually more look at a microbiome or more of an upstream hormonal imbalance, or if there was some sort of biotoxin exposure, food poisoning, root canal, viral infection that has triggered that for you. I don't think it would be the foods that you're now sensitive to all of these foods. There's got to be an issue. There's got to be a reason why now your system's reacting to all of that. A lot of times what can happen is when there's an imbalance in our immune system, we have like our innate immune system or that first line of defense. This is like the common kind of first 48, 72 hours of a flu, kind of fever, headache, joint pain. That's going to be your innate immune system. Then ideally our adaptive immune system takes over. So there's probably something that triggered your innate immune system to promote that inflammation. And now your gut just can't recover from that, or your immune system can't recover from that. And then those are all the common food sensitivities. So those are continuing to promote that inflammation, but it's probably not the food there that's the issue.
With neurofeedback, how many treatments does it usually take to see long-term results?
So with that, so when we do the neuroanalysis or that first brain map that we're seeing what's happening in your brain, how your brain's functioning, we can get a better idea of how many rounds that it would take in order to, I'm going to say, treat what we are seeing. Everybody's a little bit different. Each round would be 8 sessions. So I'll count, 8. So 8 sessions at least is what we would do. And then people, I'm going to say, normally sit around between 2 to 3 rounds of that. So 16 to 24, let's say, but it totally just depends. I'm going to say how much kind of training you've done in the past, or therapy or trauma that's been there, anything like that, then that kind of goes into how long it might take.
Mm-hmm. Yeah, very individualized.
Yeah.
What specialists will help me do all those needed tests? So you, of course, you do all of those tests.
Totally. Us at Nirvana, we have the ability to do all of those. This is kind of where it gets frustrating for everybody, I know. So like the thyroid testing, the cortisol testing, those can be done through Western medicine, your family doctor, to see if those are causing this. And then the food sensitivity test, the microbiome test, I would say a lot of naturopaths, even potentially some nutritionists I've seen have been running those as well. Because the food sensitivity, I think you can do a finger prick, so you don't need to necessarily a blood draw if that freaks somebody out too. And then the other hormones, the more of the innate, those leptin, MSH, we run those through a company in the States. So I actually don't know many clinics around that, which maybe can be frustrating, but I've asked family doctors to run that, and it's not necessarily been well received. So we do have to send those to the States to get those done. Yeah.
Awesome. There's a couple of questions about the AIP diet. So is that something, I guess, you typically recommend, or what are your thoughts on that specific diet?
I've had like a lot of people, I'm going to say, come to me already on the AIP diet. And I think that it does wonderful things, again, from like a symptomatic standpoint. People I should, not everybody, but a lot of people do feel really good when they're on that autoimmune paleo diet. For me, it's always, when it's autoimmune, we got to go back and look at your immune system. Why is your immune system dysregulated, and what can we do to make it so it's not? So it's not, again, it's like a tool that we have in our toolbox to help symptomatically make people feel better, but we still need to work on that underlying root cause of why we might need to be on that diet.
Mm-hmm. Sorry. Looking some of the questions here. Is it a safe idea to take digestive enzymes in order to help when introducing potential sensitivities?
That's a good question. So usually, if I have run like a GI map, GI 360, those tests, they do provide some insight if the digestive enzymes will help. You can see on there if there is that kind of digestive insufficiency that we need to help support. Usually once your gut's back on track, you can absorb the nutrients, you might be able to actually make those and produce them better. I've never seen necessarily, I don't know if I can confirm that they would help, but a lot of the times I've never seen them make things worse. So yeah, it's like it's at least going to help break down your food if that's part of the reason that the food sensitivities are there, then for sure it can be beneficial.
Yeah. Are probiotics good to take?
Can be. Yeah, this is also hard because it's individualized, but yeah, probiotics have some great research behind it, especially if they're, depending on the strains, which strains you might be low in or high in, how can we help balance that out? Usually for me, it's not one of my go-to like blanket statements, like everybody should take a probiotic, especially when you have a ton of bloating and gas, abdominal pain. If you do have that overgrowth or dysbiosis in your small intestine, then potentially we're just throwing more signals or bacteria in a place that we actually don't need it or don't want it. And it can make people feel worse. I think part of this too is a lot of probiotics are paired with those prebiotics. I know you can get them without that. And so differentiating if it's actually the prebiotic that's making you worse, or is it the probiotic? So some people, again, get life-changing results with them, and I think that's fantastic. And I know that they do work, but I can't say that it would be beneficial for everybody.
Yeah.
Yeah.
So when would you suggest taking the apple cider vinegar?
Why?
Or when, sorry.
Oh, when, sorry. Yeah. So usually I would say like right before meal or kind of spread throughout the meal. If we're using it, for a digestive perspective and helping, basically what the apple cider vinegar is doing, and the theory behind that is we want to make your stomach more acidic and help support that stomach acid that's in there. The more acidic that it is, then the better it is to break down the proteins in your food. So right before meal, or if you add it to a little bit of water, because it can be quite potent, then just sipping it, small sips throughout the meal, because you don't want too much water, but then that can really help.
Awesome. How often should you get a food sensitivity test, and do you help someone go through epigenetic results they may have?
Good question. So I don't know if there would be a standard that I would get somebody to take a food sensitivity test. Usually I'm going to say talking people out of it than into it. I think that, if it's more of like just, I want to know this, and there's definitely people that come and say, I just want to know this, then that's fantastic. Our food sensitivities and what our immune system is being shown is going to continually change over time. So, I wouldn't necessarily recommend it, but maybe once a year. Like if you were interested, it wouldn't be this would be more for your information versus a treatment, or you need to know. I don't think it's necessarily beneficial to always have that. I think if we can, they're just going to continually change. So I don't know if that actually provides the information that we would need in order to treat.
Awesome. Can migraines be triggered by food sensitivities? And if so, are there kind of the typical food culprits that trigger that?
They totally can be. I'd say pretty common. I would like to start, if you're just going to do an elimination diet right off the bat, Then yeah, like the big hitters that we know of: gluten, soy, corn, dairy, potentially nightshades. Nuts is up there, but I do say that less common, but it can be one for people.
Yeah.
And then like you probably know this already, but like if coffee or wine or chocolate is triggering those, then it might just be like the tannins that are in those food groups. And then we just want to stay away from those subsets.
Mm-hmm.
Yeah.
Um, so if someone's concerned about celiac, what kind of should they be getting that, like a blood test or what other tests kind of just to confirm or rule out?
Yes. So celiac, it's a blood test. Your family doctor can run this. Anti-TTG, basically that will come back. If it's positive, then they might send you for like a further scope to do that biopsy in your small intestine to see if the damage that has been caused. But usually if that anti-TTG is positive, then we are just avoiding gluten, and that's more of a celiac trait. If that is negative, then you can still have that non-celiac gluten sensitivity where it can trigger a lot of symptoms for you. And in that case, depending how severe it is, I would just continue to stay away from it as well. The caveat with that anti-TTG, and if you are worried about being celiac and you are still eating gluten, then I would recommend that you get that test before you stop eating. Once you clear that gluten, like if you stop eating gluten, then that TTG can actually come back negative, and then it'd be that false negative. And then their recommendation, if you wanted to know, would be to incorporate foods with gluten in it again, which a lot of people don't want to do because they feel awful. And then that's when they would run the blood work after that. So if you're still on it, get that done right away, and then come off of it after that to see if you feel better. But I wouldn't eliminate that before you get that blood work done.
Mm-hmm. Um, and yeah, I guess there's a couple people asking, who have maybe diagnosed with celiac and they're still having a lot of digestive issues, even going, completely gluten free for a while. So I guess what would maybe be some of the causes with
Yeah,
that?
so yeah, it is it can be a bit tricky if you're gone completely gluten-free. Cross-contamination is out, like you're not using the same toaster as anybody, everything is clear there. Then there's this frustrating side of things. It's called molecular mimicry. And there are some foods, I'm going to say like oats, potentially
Mhm.
corn, that your body actually reacts the same and thinks it's gluten because the proteins look so similar. There is a blood test you can actually run for this to see if there are any of those foods your body's actually reacting the same that it would as if it were gluten, which can be a little bit helpful so that you're not, again, taking all these big food groups out, which are very common with the gluten-free foods. So it might be something like that. Yeah.
Yeah. Um, okay. So I react to a lot of foods and spices, but it doesn't show up on a skin pinprick test. Why would this be?
That's, I assume that was a food sensitivity test versus
Yeah.
a allergy test. Okay.
Yeah.
So it might be, so with that food allergy testing, we are looking at, or sorry, sensitivity testing, we are looking at that IgG level in your blood to increase. So what is probably happening there is you're reacting to those foods, but it's not triggering that IgG response to increase in your bloodstream, and then we're not catching it. And so this is part of that food sensitivity testing too, where it's not the gold standard. It is a guide for us. So if you know you're eating XYZ food and you react every time, the gold standard would be to eliminate that and then reintroduce it after a period of time to see if it triggers symptoms. If it does, then that is a food sensitivity for you, versus it might not be. It doesn't necessarily have to show up on that food sensitivity test for you to be sensitive. This is where there's like that gray zone with it, because then you'll get foods on there that do show up and you're not sensitive at all. So it's just a
Mhm.
guide to help with that. So totally could be a food sensitivity still and not come up on there. It just hasn't triggered that immune response, or there's something else going on. It's more of like that microbiome, and these spices are actually feeding bacteria, certain bacteria in your gut, then are triggering those. So it might be something else than that. Yeah, but it's totally possible for them to not be there.
Perfect.
Yeah.
A couple of questions about heartburn and just, if you have chronic heartburn, is that a symptom of a food sensitivity?
So the most common cause of chronic heartburn is H. pylori. H. pylori is a bacteria that lives in our stomach, and in order for it to survive, lowers stomach acid, which is counterintuitive to what we think, because when we think of heartburn, we're like, oh, there's too much stomach acid here. But actually, we need stomach acid for that sphincter between our stomach and our esophagus to close. So if we don't have enough stomach acid, then that's open and you're getting all the backflow up there. So I would definitely do H. pylori. That, again, is a test actually that your family doctor can run. Stool test is more common now, but the old one was the breath test. And so if H. pylori is there, then we want to make sure that that is being eliminated so that you have enough stomach acid to break down your food. I would say that H. pylori and low or heartburn is actually more going to cause more food sensitivities to happen versus a food sensitivity to trigger heartburn. There is, from a food sensitivity perspective, there definitely is acidic foods, lemon, tomato, that will trigger heartburn, but that's a totally different mechanism of action than the food sensitivity side of things.
Mm-hmm.
Yeah.
Okay, last question. If you're sensitive to corn, does that mean you should eliminate all foods derived from corn? So example, cornstarch, sugars, etc.
So that's going to be super individualized, I think. Like if you're really sensitive to it, it might just depend, like it could be from one manufacturing plant to another. You might react actually to different foods depending on how they're processed that way. I'd say that's all like more of a trial and error thing from a symptom perspective. If you feel okay with cornstarch and not popcorn, then you might be okay with that. Kind of back to that threshold thing again of like, how much of that protein does your body need to see in order for it to trigger that reaction for you?
But thank you everyone so much for joining. Thank you so much, Dr. Morrison. That was great. Any kind of closing remarks from you or?
No, that was so great. Thank you for having me. I think that this is a topic that I'm very passionate about. So I'd be happy if anybody needs to reach out and has any questions. But yeah, that was lovely. Thank you.
Yeah, thanks so much. All right. Hope you guys all have a great night and thank you again.